Welcome to the Hinsdale Local Podcast, where we explore the journeys and stories of entrepreneurs and their businesses here in Hinsdale, Illinois. I'm your host, Brent Stutzman, and I live in Hinsdale with my wife and children. We own businesses in Hinsdale. Our kids go to Hinsdale schools. They go to Hinsdale preschools. And so this podcast is really just to kind of hear the stories of the business owners that there's so many in Hinsdale. That to hear their stories and journeys, because as I said before in past podcasts, I think one thing that makes Hinsdale such a wonderful place to live are the businesses and the people who own them, who make up our town, who live in our towns, who come to our towns to run their businesses. So that's what this podcast is about. And today I'm joined by Dr. Cara Hartman, founder and owner of Therapeutic Health. She's a well-known chiropractor and functional medicine doctor here in Hinsdale. Welcome to the show.
Thank you, Brent. I'm happy to be here.
Well, thanks for joining us. And, we met, we were just discussing this before we hit the record button. We're trying to decide during the COVID time, was it a year and a half ago or two, whatever. But we met at a birthday party at our my neighbor's house down the street. And my wife and I, Susan, we were talking to you and you're just like, oh, you're a practice owner, you're a chiropractor. And then you said, yeah, I just started renovating a building on Ogden, which is close to where our offices are. And I was like, I want to have you on the podcast to talk about a little bit of that experience. And but first, I'd love to just share a little bit about your family, how you came to start a private practice and landed in Hinsdale.
Yeah, absolutely. So I live in Clarendon Hills. Therapeutic Health is in Hinsdale. So have been a part of this small Western community for about 10 years now. I'm married with two children, Adeline, who's 9, and Knox, who is 4. And I have a soft coat Wheaten Terrier. So I love animals. And his name is Gus. Gus is definitely a big part of our family as well. I've always loved medicine. I've known, from a very young age that helping people and healthcare and kind of figuring out the root cause behind what's driving people's illnesses has always been fascinating to me. And so have just begun pursuing, pre-med and undergrad and lived in the Chicagoland area, went to National University of Health Sciences here in Lombard. So that's obviously very close to Hinsdale. And upon graduating, just kind of hung around the area, thinking that, this felt a lot like home as we moved from the city, like I think a lot of people from Hinsdale do.
Yes, they do. Absolutely. And if our listeners hear something, they are renovating an office right next to me. So it sounds like the vacuum cleaner is on right now. Well, so I like to ask this question to business owners, entrepreneurs, like, is there something in your childhood, a memory and your experience that kind of pushed you in that direction to be in the people helping medical profession?
Yeah, actually, two things come to mind. One is my mom. So she was a teacher for 30 years, and her just kind of knowing my personality. I mean, I always loved school, loved learning, kind of one of those students that just couldn't know enough. And so that coupled with, I think, my personality, very outgoing people person. My mom was definitely suggestive of, Cara, you should try medicine. She was very encouraging, like every day's different. So it's not redundant, it's not repetitive. And that was definitely something that really, really appealed to me. And then funny enough, right around that time, this was probably the early 90s, the show ER came out. Oh. And I really, really became addicted. And in fact, I was the first student in my high school to land a preceptorship at a level 1 trauma center in Rockford, which is a little bit about 30 minutes from where I grew up. So yeah. I ended up working in the ER, in level 1 trauma centers, like you're seeing, everyone's helicoptering their most severe cases into you. So from an experience standpoint, I was just able to gain so much exposure to medicine from patient care, which is what I did a lot of, patient transporting. I was responsible for, back then it was all, handwritten note taking in the traumas, and just kind of being that reliable assistant to the doctors, and just the whole environment from the upbeatness of it, the busyness of it, the different people I was exposed to, policemen, ambulances, doctors, families. It's just the whole scene I just felt really at home with. So those two things kind of come to mind as being big players into, I think I should check out medicine.
Yeah. Now, how did becoming a chiropractor then? Because obviously trauma, you're dealing with a lot of blood, a lot of wounds, a lot of, so I'm curious, how did that, then you shift into doing chiropractic work and functional medicine?
Absolutely. I think the functional medicine piece comes from just being a problem solver. So I learned to draw blood since I was 16 years old. And in functional medicine, you're obtaining labs, whether they be from the blood, the saliva, the urine, a lot of different ways to test things, but always a problem solver, which is where I feel like the functional piece comes in. And then the chiropractic was a decision that I made right after college, actually, when I was trying to decide what path I wanted to go down. I loved the idea of just active medicine. Have been an avid runner my whole life, softball player, and basketball as well. So always been athletic, and wanted to try to mesh medicine into what can I do to keep people moving. And not just in athletics, I do treat a lot of sports medicine patients, but just in general, people wanting to continue to run with their kids and lift their grandkids and strive to participate in their family dynamic is really, I think, attractive piece of the chiropractic side. And then the functional medicine just works really hand in hand with that, because when I'm taking a good, thorough patient history, I'm finding, what sort of sleep disturbances, stress management, or lack of management skills patients are having, digestive issues, hormonal issues. It's just like everybody has these sorts of things. So in talking more thoroughly with my chiropractic patients, I'm finding a lot of those kind of functional deficits that I let them know I can help them with as well.
Yeah, I've been helping out in my line of business. I've been helping out. I help mental health professionals, and so I have a few psychiatrists, and there's a big push to like integrative work in psychiatry, and it's not just prescribing pills, but it's like, we got to look at the whole person. And I think that just makes absolute sense, especially the mind-body connection, all the science that's coming out with that we've kind of ignored for a while. I mean, some people knew about it, but for a lot of the medical community, they did not. And so, that's really great. A lot of functional, so you're bringing it together because, that makes sense, because you you're very curious, and the body's so complex. So instead of just saying like, just do this one thing, but you're actually looking at the whole person and maybe prescribing or recommending a couple of things to actually get to the root cause so they can get back to living their life. Yes,
definitely. And, even take just a quick example, a low back pain patient. Someone comes in with low back pain, and, whether their disc is inflamed or their joints or their nerves, inflammation is a driving role. Potentially muscle weakness is playing into that. But this inflammatory cascade, we can send them away with different nutraceuticals, different ideas for anti-inflammatory support that they can start to take to help the pain. Definitely want to talk to them about an anti-inflammatory diet, because even though it seems indirectly related, those joints are housed within the forest fire. And if the body's a forest fire, maybe this month it's the back that decide to flare up, but maybe next month it's the knee, or next year it's the shoulder. So it's really kind of connecting all these lifestyle habits and tying it into the low back pain as well.
Yeah. Okay. Well, speaking of lifestyle habits, I'm curious. I always ask business owners, like, one, how is it navigating COVID as somebody who actually, like, telehealth could be a little tricky as for a chiropractor, right? So I'd love to hear a little bit about that. But also, like, for those who are working from home, I'm curious, like, what are you, who's coming into your practices? Like, what are kind of the symptoms that people are having, maybe because they're working from home or they're stressed or whatever? I'd just love to hear your thoughts on what you're seeing.
Definitely. We were fortunate enough where, like, during COVID, we were able to stay open.
Mm-hmm.
We actually started seeing different kinds of patients. Some of my maintenance type of patients hunkered down for a few months, as instructed. Mm-hmm. But then with a lot of other facilities closing down, it left those patients in severe musculoskeletal distress that were maybe afraid of going to the ER or afraid of going to a hospital, because that was kind of designed for if you have COVID, right?
Mm-hmm. Everybody stopped going to the hospital.
Cases. Yeah. And then those maybe those people didn't even want to go to the hospital. Mm-hmm. So we started just seeing a different type of patient during COVID. And then after COVID, or, once things started opening up a little bit, that's where the functional side, the functional side's always been busy, but I feel like it's been busier than ever with patients realizing maybe how unhealthy they are or they were. COVID flipped on a lot of autoimmune in patients that they maybe didn't know existed.
Yes.
And those are the patients that I'm seeing now. We're seeing some long haulers. We're seeing, in young people, like, to me, age isn't really a number here. It's more of like, what is the integrity of their health? Mm-hmm. And, so it's been, eye-opening, and I really commend those patients that realize from COVID that their body's really not maybe quite as up to the ability that it should be to fight off these sorts of triggers.
Yeah. Oh, I need to have you talk to Susan, my wife. Because the autoimmune thing is, according to there's a lot of it gets triggered by stress and traumatic events as she works with kids, like, all of a sudden, and like parents and just crazy stuff that never happened. So anyways, it'd be good to have you guys talk, because we went through a collective traumatic event, like, because all my private practice clients, my mental health, they're completely filled up. Like, it is just, there's waiting lists. There's so many people who need help and support. But the autoimmune thing is really interesting from a mental health perspective. But anyways, that's a side tangent. Love to get you guys talking and have a podcast on that, because I think a lot of people need to know about this stuff.
Oh my gosh, I would love to dive deeper into that. Even the gut-brain connection, the neuroemotional technique, which can complement different therapies and services. There's so much that can be done connecting those two pieces, because they actually are physically connected through the vagus nerve. Oh, yeah.
Oh, you and Susan will have a total nerd out session that people would love. Yeah. Well, okay, I'm going to stop, because I'll nerd out with her. I vicariously live through other people, and because I find their job so interesting. Well, okay. Well, tell me about, you saw this little brick building that was vacant for so long. And for the years and years I've been driving on Ogden and driving past this building. This was like Audio Consultants or something.
Yep.
And I was like, there's no windows in this building. And then I'm like, well, I guess that makes sense for audio. They maybe want it to be really quiet, but I'm like, there's no windows in this building. So I would love to hear the journey to buy this building, to kind of like, what's your vision for it? Like, I would just love to hear that.
Oh, I'm so excited. I'm so excited you asked. I can't wait to tell you about it. So my vision, Brent, actually started about 2 years ago. So it started very pre-COVID, and it was definitely more functional driven. Just this desire to establish another medical entity, a clinical entity that starts to pave the way that I see medicine. And of course, it's not the only way medicine should be. It's just the way that the patients in my clinic and in the supportive care that I can provide them, just how it should be. I started to get that vision, and I walked into my architect's office. It was July of 2019. So actually we're almost like 2.5 years now. And I sat down kind of like, I have a dream. And so he gets out his notebook paper and he starts just writing everything down, and it slowly kind of got the ball rolling. And, living in Clarendon Hills, I pass that building every day, and it just started calling my name. I love the location of where, Therapeutic Health is. And now it's in the medical district of Hinsdale. Parking is very ample. And we treat people from all over. And so I love the highway access. It's just the location of the clinic is so perfect for
it's like
for
York and Ogden, kind of like right that intersection.
Yes, we're actually, Therapeutic Health is currently just about 100 feet, I would say, east of York, Ogden, and the new clinic is just about 100 feet west. So kind of equally spaced on either side. But so then after that, one of my mentors in the field of functional medicine and chiropractic, his name is Dr. Tom O'Brien. He's written a couple great books, The Autoimmune Fix, and Susan would probably like this one, You Can Fix Your Brain. And it's all about the functional effects, kind of just how we practice now. And it's very, user-friendly. And so Tom O'Brien reached out to a group of doctors and invited us all to Switzerland. And this is I just beam about this. This was 2018. This was August of 2018. We went to Switzerland and we stayed at Switzerland's top biological medical center for 10 days.
Wow.
And my whole reason for going was, of course, just to get healthy and even detox and learn all these new and experience all these techniques. But I wanted to see kind of what a top European functional medicine, biological medicine clinic, how it looked, how it ran, what sort of modalities did they implement, how did I feel receiving the treatments, things like that. And I left Switzerland with a pretty clear vision. And even from a treatment, like my radio frequency machine is from there. So I've even gotten some new services in the clinic because of that trip to Switzerland. But I had enough time to kind of think about, personalizing that Swiss clinic into my vision here on Ogden Avenue. And, so, it will include functional medicine. You'll see a lot of me posting about biological medicine as well. I feel like that's a term that I use rather interchangeably, just because I want this clinic to have a little bit of that European style effect. Okay. I feel a lot of my chronic patients, they go to Europe for treatment. There's just certain limitations that we have here in the U.S. where in some cases, Europe is the leading, or if they want to get a different type of treatment or service that maybe you can't even get here in the U.S. So that's where the biological medicine thing became very kind of unique and attractive to me. And that kind of lays it out. And so everything was moving along really, really well. We hit a little hiccup in the road when COVID hit, but it wasn't actually because of probably most people, how COVID affected them, but more so from a fact that our source of financing switched to all PPP stimulus loans. So banks weren't even funding these types of loans for these projects. They just literally switched to PPP because that was the priority for them. And I had about a heartbreaking 6 months. I wasn't sure if the project was gonna go. The COVID, the stimulus loans, I feel like the country was just in a financial state of panic, and the priority wasn't, again, this type of loan. So the fact that we pulled through, we made it work. I'm so proud of that. And even from a standpoint of looking at funding for a project like this, it's a lot of checking in with the banks, and they're keeping a very watchful eye on you because of COVID. They want to know, like, hey, we're not gonna fund this project and then and then the project doesn't go through. So
Right.
I think it's just been a testament to just the hard work. I mean, definitely my husband behind the scenes, like handling all the side of this that, I'm best in patient rooms face to face with my patients. And there's so much behind the scenes that, without him, and just, the hours that he spent a week getting the banks what they needed, you can't even imagine.
Yeah. I can't imagine. I can imagine how insane it would be to do something like that. Well, as I drive by it, I'm seeing, the chain link fence is up, and you're doing some demo work on the inside. Then I see some like scaffolding maybe on the second. Are you going to do a second level? Or
we are.
Okay. All right.
Oh, yeah. So this is going to be a 6,000 square foot center.
Okay.
And so it's going to have a whole second floor added. We've already taken out the south wall, which if you're kind of traveling slow eastbound, you can look back there and see that the whole south wall is gone. And that new addition will expand back about 23 feet.
Okay.
And we'll have some hydrotherapy back there that I was kind of inspired through my Switzerland trip. And lots of windows. Actually, probably this week or next, you're going to see.
I was going to ask, are you going to have windows?
Almost the entire. So what's actually taking so long is the amount of steel that's going into this building, because truly we're leaving 3 walls of it. And of the 3 walls, probably 70% are going to be windows. Yeah,
you need steel.
So they are just being so ginger with those walls that they're not going to fall. So yeah, the plumbing's done. The permit and inspection for plumbing is all done. Kind of
Congratulations.
All the non-fun stuff, the stuff you can't see. There's a lot of work happening, but in truly these next probably 2 weeks, you're going to start to see visually the clinic really take shape.
Oh man, how exciting. So then we know that's when you build anything, it's like the bigger stuff on the outside that doesn't take so long, but it's all the fine tuning and all the other stuff on the inside. So hopefully you guys can get it closed up before winter, and you can work on it in the wintertime then.
That is the goal. I had a call with my contractor this week, and I said, are we going to get a roof on this thing before it snows?
Yeah.
And he promised me yes.
Good, because a couple of years ago it snowed during Halloween.
It did. I'll never forget that. Forget that. But I'm telling myself, if we do get a snow like that, that I know there'll be nice days after, and there'll be more time to do work.
Yeah, that's right. That's right. So okay. So this dream is coming true for you, this vision that you have for this building. I think the location's awesome. I'm so glad to see that little brick building be repurposed. Yeah. I'm curious. I asked this question too, is sort of as we close some things out, is I think about like Hinsdale Central high school students or Hinsdale South students. If they were to get, what would you give someone advice, maybe a junior or senior in high school who might be interested in chiropractic work or functional medicine? Like, what would you say? Hey, maybe think about interning here, or look at these things, get some experience here to see. Because I talked to Dr. Carey at CHT Orthodontics and in Hinsdale, and it's like you go to medical school. I mean, that's a lot of money. It's a lot of time. So what would be your advice be to high school students to be like, hey, before you go down this path, try to get some of these experiences. What would those experiences be?
To put yourself in as many different situations as possible, because you'll start to learn what settings you gravitate towards, which ones, that was good for me to see, but maybe that's not my personality or where my passions are. When I think of from being in the ER to, chiropractic clinics and shadowing them, I had also shadowed family practice. I had shadowed surgical ward and in operating rooms. And so in the good news is colleges will help you a lot with that, but anything that you can do to talk to someone, or especially locally, like how easy that, even for example, Therapeutic Health is here. And, what I welcome a student into to just see what a day in the life looks like for observational purposes. Yeah. I think that nothing would make me happier than if someone found their calling, because of our clinic. And I even have, 2 patients off the top of my head that I can think of that are now pursuing a functional medicine assistant degree. Wow. To come work in our clinic because of their success stories and how it's changed their life and how they've changed others' lives. So it does kind of become this really neat, powerful, positive network, and just get out there and experience as much as you can.
Yeah. Well, thank you for that. How can people get in touch with you, find out more about you if they want to seek you out?
Yeah, thank you for asking. We have a website, therapeutic-health.com. We also are on Instagram at Therapeutic Health. So we do postings pretty frequently. We're also doing kind of a little scrapbook, I guess you could say, of the project. So you can check out some of our highlights there with where the little brick building has been and where it's going.
Yeah.
So
I just feel like that building's been there forever. Like it's just been there for so long.
Brent, I've talked to that building just for years. I'm just like, I have told him for so long I'm coming for him, and he was waiting for me.
Yeah. Well, do you know how long the building's been there? How old it is?
I do. Oh, how long it's been there? So the building has a unique history. It actually was a pharmacy. I think like 40, 50 years ago. And then Audio Consultants bought it, did an addition, because now that we're doing our edition, we can see where Audio Consultants edition was. And I want to guess Audio Consultants maybe had it for about the 40 years.
Wow.
So it is. I've actually learned a lot about the history as I've owned it, which I guess is good. But yeah, it really, the building has been sitting there for so long just because of its location. I know that a lot of the businesses that were interested, because trust me, it's been a very sought out location for a lot of different franchise businesses. And I think the main reason that wasn't going to pan out with the Village was just the proximity to that York-Ogden intersection. It backs up. It's very congested, and to have, high volume sorts of traffic through that location, I think just they were really kind of protective about what kind of business would go there.
Yeah, if you imagine like a drive-through Starbucks, you're like, yeah, that's not going to work.
No, and that's actually one of the attempts was a drive-through Starbucks.
Yeah.
So yeah, if you're at York-Ogden at 5:00 and you had a drive-through Starbucks hanging off into Ogden, I don't think it would go well.
No, it wouldn't. Well, thank you so much for joining me. We'll put the links that you mentioned in the show notes, and thank you for your time. Really appreciate it.
Yeah, Brent, I appreciate you having me on.
All right, folks, thanks for listening. If you found the conversation useful, please subscribe to the podcast and join me the next time for the Hinsdale Local Podcast.